Hello, welcome back. We are going to continue our journey through different representative articulations with this video is going to cover the elbow and the hip. So I'm going to talk about the elbow first and then the hip, even though I know they aren't sequential in the notes. I just kind of combine them into this one video so we don't have a whole lot of videos for chapter 9. So we're going to talk about the elbow first. So the elbow is the articulation of three bones. You have the humerus, the radius, and the ulna. So we're going to take a look at the ligaments and what holds this kind of pretty complex joint together. So I have my bone models. So I'm just going to show you each one. I'm not going to be able to hold all three of them and talk at the same time. I'd probably just drop everything. So we're just going to look at the distal end of the humerus. So anteriorly, we should be recognizing the capitulum, the trochlea, the coronoid fossa, and on the back side, we have the olecranon fossa, and then our two epicondyles, medial and lateral epicondyle. So on the capitulum side, right here, this is where the head of the radius is going to articulate with that capitulum. It goes like this. So when we are looking at the outside edge, make sure I get it right, yeah. So there's going to be a ligament that's going to go from the humerus to this edge of the radius, and this is what we call the radial collateral ligament. Okay, so we can see that right here. So just underneath the medial, lateral epicondyle of the humerus to just around the head of the radius. If we take a look at the other side, okay, so where the trochlea is, so this is where the ulna sits. Okay. So here would be the ulnar side of the joint. So then there's going to be a ligament that's going to go from the humerus down to the ulna on this side. So this is what we call our ulnar collateral ligament. There we go. Okay, on the medial side, like that. Okay. So those are the two ligaments on the side, and they're called collateral because if you look at your elbow, it kind of has a midline. So collateral, they're ligaments that are on both sides of the joint, collateral. And then the annular ligament kind of hooks around like annual, like a ring, okay, goes around the head of the radius. So it's going to kind of loop around like this and help hold the radius in place because the radius is going to be turning when it's doing that pronation and supination. So the annular ligament kind of loops around the head of the radius and holds it in place. All right, so that's our elbow joint. It's not very complex. So we have the three bones, radius onto the capitulum, ulna onto the trochlea, right? And that makes your elbow joint. Hinge joint, monaxial. Good? Okay, so now we're going to take a look at the hip. So the hip is one of our triaxial joints, a ball and socket. So let me put my arm bones away and grab my hip bones here. So here's the proximal end of the femur. And here's our os coxa with the acetabulum, right? So here's my ball and socket joint. Okay, so we're going to take a look at the structure here. I've also provided an x-ray there on the view so you can see how they fit together. With the hip in the acetabulum, right? So the acetabulum is the socket right here. So it is lined by a fibrous cartilage pad, and it also has what's called an acetabular labrum. I'm not pointing in the right direction. There we go. So right around the ring of it here, this word right here, labrum means lip. So there's a little lip of fibrocartilage that kind of helps deepen the socket a little bit. We'll see one of those on the shoulder as well, the glenohumeral joint. And then there's a little fat pad that kind of sticks down here on the very bottom for padding. So it'd be like kind of right in here is the fat pad. And then we get cartilage, and then there'll be articular cartilage on the head of the femur. So when they articulate, smooth surfaces against smooth surfaces, right? That's what we want. So there are 5 ligaments associated with the hip joint. 2 of them are kind of intracapsular, semi-intracapsular, and then 3 of them are regional thickenings, which means it's the joint capsule, but there are some thickening parts of that capsule that have their own name. So, and they're named for where they start and where they end up. So we have pubofemoral, iliofemoral, and ischiofemoral. All right, so I'll try to do this the best I can. So this is a right hip. So the pubis is right here. Ischium is back here. Acetabulum. So here's the femur, sits in here. Maybe my table can help hold it up. So when we are taking a look at the pubofemoral, it is going to be a ligament that's going to start here on the superior ramus of the pubis, kind of right in here, and it's going to wrap itself around and connect to the femur. When we take a look at the iliofemoral, it's going to be more up here. Okay? And then when we take a look at the ischiofemoral, that's going to be more on the back side. It's going to originate like right here on the ischial tuberosity. So all three of those just kind of start on the hip bone, on the os coxa, and twist and kind of wrap around and completely enclose the head of the humerus within that joint capsule with these regional thickenings, which are these ligaments. So iliofemoral, pubofemoral, and ischiofemoral are the regional thickenings of the joint capsule. That's 3 of the 5. The other 2 kind of originate inside. So you have this one here called the ligament of the femoral head. And if you'll notice, it's going to start kind of right down here in the acetabulum, and it goes and it connects. If you've ever noticed this little dent right here, this is called the fovea capitis. So the ligament of the femoral head is like an anchor. It's going to originate here in the acetabulum and then hold on to the head of the femur at that little fovea capitis right there. And then the last ligament is called the transverse acetabular ligament. And if you'll notice, the acetabulum kind of looks like a horseshoe. It's not a complete circle. So down here, there will be a little ligament that's going to span that notch, this acetabular notch. And so this is our transverse acetabular ligament. And then from there is going to, the ligament of the femoral head is going to come out of that and hook onto the head of the femur. All right, so those are the ligaments and structures associated with the hip joint. I also have included a picture of a hip replacement. Now, there's a lot of reasons why people get hip replacements. Maybe they've fallen and broken their hip, or they might have damaged their cartilage, and so it's bone on bone, which is very painful and incapacitating. So with this particular procedure, we can see just some of the technical words. So cement-free implant 16 days after surgery. The femoral component is cobalt chromium combined with titanium, which induces bone growth into the implant. So I'm going to highlight, this is the femoral component, right? All of this is the femoral component, what I've highlighted in green. So basically what they've done for this particular individual, they've completely removed the head. So this is gone. The trochanters are still here, right? So the greater and lesser trochanters, and then all of this deep down into the marrow cavity has been replaced by this cobalt titanium combination implant, right? So they've replaced the head, and then the with the ceramic head, and then the acetabular cup is, it says acetabular cup coated with bone growth inducing material and held temporarily into place with a single screw. Okay. So you can see the screw going up into the hip bone, and then here is the acetabular component. So that is going to eventually kind of blend in, the bone will grow around it and will become a permanent part of that patient's acetabulum. So they have a replacement head of the femur and replacement cup, if you will, of the socket of your hip joint. Okay, 16 days, that looks pretty good. Okay, so that wraps up our elbow and hip. The last video is going to be shoulder and knee, which are pretty complex. And then I think I talk a little bit about arthritis at the end of that video. So one more video to wrap up our chapter 9 discussion. All right, I'll see you next time. Bye.